What is LVAD? LVAD is a left ventricular assist device that is implanted in the chest. It helps pump blood from the left ventricle of the heart and onto the rest of the body. A control unit and battery pack are worn outside the body and are connected to the LVAD through a port in the skin. A left ventricular assist device, or LVAD, is a pump that is used for patients who have reached end-stage heart failure. It is surgically implanted, a battery-operated, mechanical pump which helps the left ventricle. Left ventricle is the main pumping chamber of the heart. LVAD will pump the blood from the left ventricle to the rest of the body. The HeartMate 2 left ventricular assist device is implanted in the chest below the heart. One end is attached to the apex of the left ventricle. The other end connects to the ascending aorta. The pump diverts blood from the weakened left ventricle and propels it to aorta. Indications for use. The HeartMate 2 left ventricular assist system is indicated for use as a bridge to transplantation for cardiac transplant candidates who are at risk of imminent death for non-reversible left ventricular failure. Bridge to transplant therapy is a life-saving therapy for patients awaiting a heart transplant. Patients use the LVAD until a heart becomes available. In some cases, the LVAD is able to restore the failing heart, eliminating the need for a transplant. It is also indicated for use in patients with New York Heart Association or NYHA Class 3B or 4, end-stage left ventricular failure, who have received optimal medical therapy for at least 45 of the last 60 days, and who are not candidates for cardiac transplantation. This is the destination therapy. In this case, patients can receive long-term treatment using an LVAD, which can prolong and improve patients' lives. Contraindication. LVAD is contraindicated for patients who cannot tolerate or who are allergic to anticoagulation therapy. LVAD patients require lifelong anticoagulant therapy to reduce the risk of pump thrombosis. LVAD patients cannot be pregnant. It is because it is high risk for both the mother and the baby. LVAD is also not be considered when the patient has non-reversible end organ failure. Adverse events: death, bleeding during perioperative or late, cardiac arrhythmia, local infection, respiratory failure, device malfunction, sepsis, right heart failure, driveline or pump pocket infection, renal failure, stroke, neurologic dysfunction, psychiatric episode, peripheral thromboembolic event, hemolysis, hepatic dysfunction, device thrombosis, and myocardial infarction. History of LVAD. The first left ventricular assist device system was created by Dr. Domingo Liotta at Baylor College of Medicine in Houston in 1962. The first left ventricular assist device was implanted in 1963 by Dr. Domingo Liotta and Dr. Ernest Stanley Crawford. The first successful implantation of a left ventricular assist device was completed in 1966 by Dr. Michael E. DeBecky to a 37-year-old woman. She had the LVAD for 10 days until her heart transplantation. There are 4 parameters monitored on the HeartMate 2 left ventricular assist device: the speed, power, flow, and pulsatility index. No single parameter is a surrogate for monitoring patients' clinical status. It is important to consider trends. Pump parameter values are patient-specific. Pump power. Pump power is measured in watts. It is related to pump speed and flow. Under normal patient conditions, power should remain within a certain range for a specified speed. If the speed increases, the power is also increased. If the speed decreases, the power will also decrease. For the flow, when the flow increases, the power will also increase. It takes more work to move more blood. However, if the flow decreases, the power will also decrease. It does not compensate for increased afterload. Pump power is normally increases or decreases with pump flow and speed without abrupt changes. Power fluctuations of 1 to 2 watts do not necessarily indicate a problem, but should be closely monitored. Power values greater than 10 to 12 watts requires further investigation. Fluctuations related to bearing setting. Some pumps exhibit high power consumption for several days post-op and then drop to normal. Power will abruptly rise or fall for 2 watts. Monitor trends for both increase and decrease in watts. Check if the patient is symptomatic. Pulsatility index. The pulsatility index is the magnitude of flow pulse through the LVAD pump. When the left ventricle contracts, the increase in ventricular pressure causes an increase in pump flow during systole. In the HeartMate 2, these flow pulses are measured and average over 15-second intervals and reported on the patient controller. The pulsatility index values typically range from 1 to 10. The magnitude of the pulsatility index is the magnitude of flow pulse through the LVAD pump. The PI is related to the amount of contractility provided by the native heart, as well as the preload entering the LVAD. Higher values represent more ventricular filling and contractility. It means the LVAD is providing less support to the left ventricle. Lower values indicate lower filling pressures and lower contractility. The LVAD is providing greater support and unloading the left ventricle. The pulsatility index should be relatively stable under resting conditions. A drop in PI is either secondary to a decrease in circulating blood volume or a marked decrease in native left ventricle contractility. Given that patients with LVADs have relatively poor contractility, it is far more common for a PI drop to be a marker of hypovolemia. This should prompt evaluation of intravascular volume and possible bleeding, given the need for anticoagulation in this patient population. But note, one single pump parameter is not diagnostic of any particular pathology, and relevant data must be considered as part of diagnosis and management. The pulsatility index is a measurement of flow pulse through the pump. It is determined by pump speed and the degree of native left ventricle contractility. Pump speed determines the amount of left ventricle unloading. As speed increases, the pulsatility index goes down. As speed decreases, the pulsatility goes up. So therefore, changes in pulsatility index is indicative of changes in volume status due to altered preload and changes in the natural heart's contractility. To summarize, pulsatility index represents the magnitude of flow pulse through the LVAD. It reflects the degree of left ventricle contractility. It is a marker of circulating blood volume and native left ventricle contractility. A fall in PI should prompt evaluation of volume status and native left ventricle function. Pulsatility index will naturally vary by patient. Pump speed. Fixed speed range from 6,000 to 15,000 RPM. Typical range is 8,000 to 10,000 RPM. It is sensed via motor. Failure to maintain fixed speed in absence of PI event indicates pump, percutaneous lead, or controller issue. PI event. The HeartMate 2 incorporates a suction detection algorithm to help reduce the risk of left ventricle collapse. The system monitors sudden changes in pump flow pulsatility, a PI event. If a PI event is detected, the pump speed is automatically reduced to the low speed limit setting. The default is 9,000 RPM to avoid suction. Immediately following an event, the operating speed displayed on the monitor will be lower than the set speed and then slowly return to the set speed. PI event versus suction event. PI event occurs when there is a 45% plus or minus change from the previous 15 seconds running average. Not all PI events are true suction events. Suction event. Suction event is when physical structure occludes the inlet, causing 45% change. All suction events are PI events. PI event calculation. PI event is detected by looking for abrupt changes in the calculated PI. The PI calculates once per second and added to a 15-second running average. PI event assumed whenever the per second PI differs from the average PI by more than 45%. PI event occur when the ectopic beats can occur during suction events. If the inflow cannula contacts the ventricular wall, evaluate the patient for dehydration and arrhythmias. Evaluate the patient at lower pump speed. Assume for all instances the speed is fixed and the patient's blood pressure is stable. Can you take blood pressure on LVAD patient? Since LVAD patients do not typically have palpable peripheral pulses and blood pressures that can be measured by automated cuffs, getting a map or mean arterial pressure using of a manual blood pressure with a Doppler ultrasound is how to obtain the blood pressure. Attach a manual blood pressure cuff to your patient's arm, inflate above 120 mmHg, then slowly deflate it while having the Doppler ultrasound probe over the brachial artery. Can you shock a patient with an LVAD? Defibrillation can still be performed in patients with ventricular dysrhythmias. External chest compressions, however, should be avoided and are last resort for patients without evidence of perfusion. Conventional CPR may dislodge the LVAD connection from the heart. That's all for today's video. Thank you for watching. If you are new to my channel, press subscribe in my YouTube channel, follow me in Facebook, press the notification button to be notified with my upcoming videos. Thank you for your support.